Hi, everybody. Good morning. Thanks for coming in today. My name is Alex. I'm an occupational therapist at Ohio Health. I work in outpatient neurologic rehabilitation, and my specialties are wheelchairs and assistive technology, mostly. And then I treat also general neurologic populations. So I see folks with MS all the time. So I'm going to be talking today specifically about assistive technology solutions. I'll talk about what that means and whatnot for patients with MS and how it can improve quality of life. But also I do want to do a brief little caveat about occupational therapy in general, when to come back to therapy. Alyssa will also go over this a little bit later, just so we can plug for therapy. So that's me. I've been an OT with Ohio Health for 4 years. I was a neurologic fellow at Ohio State before then, and I did all my degrees at Ohio State. And I focus mostly, like I said, at neurologic conditions at my site. Occupational therapy, though, if you aren't sure, is not just helping you on the job, which a lot of people think is like getting you back into work. Our job is overarching to increase independence in daily tasks. So that can mean dressing, bathing, cooking, cleaning, driving, work. But additionally, we work on upper extremity strength and coordination, vision, tremor management, as well as creative problem solving. So if you're like, I have MS and I really want to be able to go on hikes, or if I really want to be able to continue photography as a leisure activity, that is part of our job. We also do adaptive equipment and assistive technology, which is basically things you can purchase or make that can help you to be as independent as possible. So assistive technology is a subspecialty of OT, so it is specialized, but some OTPs, that's occupational therapy practitioners, are comfortable with doing AT. So if you're already in occupational therapy, you might not need to go seek out a specific person, just ask your clinician that you work with. But there are some specific things that require additional certifications. So I'm an assistive technology professional, went through a certain number of hours of training to do this, and so my job, some of it is a little subspecialized. So what is assistive technology? We use it. You got your phones, you got your laptops, those are all assistive technology, but also wheelchairs can be considered AT. Your smart home, your smart thermostats, your Alexa, all that stuff. Tremor, dampening orthoses, there's all sorts of stuff. So basically it's any item, piece of equipment or product that can be acquired commercially off the shelf, customized or modified to increase or maintain and improve functional capacities. So it's a lot of stuff. Your reachers and grabbers and sock aids and all those things are also considered low-tech assistive technology, but we're kind of talking a little bit more in the scope of a little bit more higher-tech things. So real-life AT devices, things that you probably use in your day-to-day or have used, if you have MS or not, are all considered assistive technology devices. Why do we use it? It's proven in research to improve quality of life. Luckily, we are in a day and age where technology is going faster than we can keep up with. This presentation is out of date as soon as I make it, every single time, and because we have so many things that are in development, which is awesome. And with acceptance of that technology, we have the opportunity to reduce caregiver burden and help the patient with MS to be as independent as possible for as long as possible, which is fantastic, even when we have problems with mobility and upper extremity function, tremors, thinking skills, all of that stuff. It's also shown to improve home safety, reduce falls, as well as increase participation in important things. The basis of occupational therapy is occupations, which are your daily tasks, the things that are meaningful to you. Why do we get up and walk, or why do we roll in our wheelchair? To go do stuff, right? That's life. So our job is to help you to do the stuff as independently as possible. Assistive technology clinic. So frankly, assistive technology clinic is like occupational therapy. You go to a session, you meet with me or my coworker, Christy. We're the only people in the system that do it right now. And we meet with the patient, meet with you guys, and say, what is it that you want to do? And we try to find the happy medium between those patients that are quite tech savvy, which I have a patient right now who has low vision, and we're working on very complicated things, all the way to the client that just says, I just want to be able to text my grandkids, and everything in between. And our job is to find solutions to those problems. We create goals and identify priorities. We determine follow-up method. Oftentimes we're training in clinic, but we do have at least one person that can come out to the home to assist in home health therapies, which is a nice tool. And then we educate and train to make sure that the patient feels comfortable, the family feels comfortable. We are in an outpatient setting most of the time, and our job, again, is to make things as individualized as possible, focusing on computers, smart home, smartphones, tablet, in the home environment. But also we've gotten to some creative solutions that are outside of those as well, which has been fun. What is not offered in AT clinic, but actually is offered within our system, almost all of them, wheelchair evaluations. I do wheelchair evaluations as well at a different clinic, wheelchair clinic. If you feel like you might require a wheelchair or your wheelchair currently is not fitting you, and you want to use a wheelchair as a tool, for some people they have to use it all the time. For some people it is just when that endurance is poor, just when it's hot outside, when you go to Disney or when you're going to the zoo. But for some people it is their mode of transportation all the time. Consider wheelchair clinic. AAC, this might not be something that any of you require, but if you have any issues with communication, assistive technology, AAC, alternative and augmentative communication, basically like a tablet that can speak for you, might be an option for some. Home modifications, our traditional neuro-occupational therapists are trained to help with modifications in the home. You say, my house is not working for me, what do I do? How can I change it? We can make modifications and recommendations for that. As well as we have specific home modification specialists out in the community, like contractors. Adaptive equipment like those reachers, those sock aids, rocker knives, button hooks, all that stuff is also traditional occupational therapy. The only thing that we don't do in our system is functional capacity evaluations, which is like some people require those for the return to work process, and your employer would require that. But that's the only thing that we do not have in the system, I don't think. And then the rest of them we do. It's just not AT. Okay, some common assistive technology devices that I have recommended for my patients with multiple sclerosis. Smart home technologies, emergency assistance, phone and computer modifications, low-tech technology, or low-vision technology, cognitive aids, and then task-specific problem solving. We'll go through each one of those. But some of these things probably look pretty familiar. You have an Apple Watch, you have an iPhone, you have the Alexa, you have a computer screen that has magnification on it. So all of these things are readily available to people. We'll talk a little bit about funding as well before you get frightened. Some of this stuff can be kind of expensive. So smart home technologies. I think that this day and age, I feel like about half the people that I meet have something in their home that's smart. And that can be an Alexa, a Google Home, a smart thermostat. So there's smart fridges, there's smart dishwashers, there's smart everything. There's Roombas, there's all sorts of things. So our job is to choose and help to choose devices that work as a team and also to increase your independence. So there's some devices that will not be very helpful for a person, like a voice-activated device for somebody with poor voice. That wouldn't make sense, right? So our job is to try to find the right marrying of product to person. Much of this assistive technology is getting super cheap, which is fantastic, and it's becoming very mainstream. And they utilize personal assistants, virtual assistants like the Amazon Alexa, Google, and Apple, Siri, and Alexa, and Hey Google, in order to operate these devices. So a couple of them that we do a lot is the thermostat that's up there, smart lights, and then smart locks that you can change and activate in lots of different ways. These are sort of the primary functions that we would normally promote, like being able to activate your lights, your TV, your plugs, your fans, all that kind of stuff. But then also we can use smart home technology for reminders and calendars. I have one patient that utilizes it every day, so every few minutes there's kind of an alert that comes out. It's time to take your meds. It's time to go to the restroom. It's time to sit on the couch. It's time to stretch. Just because her memory is impaired, and it's just something that reminds her throughout the day of her routine. And so for some people who forget to take their meds and whatnot, this can be an amazing way to remind them. Same as like an intercom. So if you have a family member that wants to check in on you and is not able to in traditional means, like through the phone or whatnot, they can intercom in on these smart technologies and say, hey, you good? And you can be like, yep, I'm good. Or they can have a video camera that can check in on a patient as well, which is super cool. I think that a lot of people have some limitations and some fears about smart home technologies because technology can be kind of scary. Things are listening in on you and recording your information, and I think to an extent that is a very understandable fear, but just know that a lot of these things have a lot of protection within them, and we also can be trained to only use the features that are necessary. If it can do this much, you only have to use a certain amount, just it's whatever the goals of the patient is, right? It's whatever you guys need. Another focus area that we have is emergency assistance. Every person who's at risk of falls should have an emergency assistance plan put in place. And many times people with MS are at risk for falls, right? So for a lot of people, I like to make sure that they at least have a phone, a smartwatch, a call button, or a home automation system like an Alexa that you can shout out to or an alert in case of a fall. That will tell your emergency contacts, hey, I'm not well, or I am well. So our job is to help match and try to find the correct object for the correct program for a patient. We also have used things like the My SOS Family app, the AirTags for tracking people if they get lost when they're driving, fall detection on Apple Watches. There's all sorts of things that we can help pair a patient to. But also just know that if you have these things available, just make sure that they are readily available to you and you know how to use them. Some people have tech-savvy family members and they don't necessarily need assistive technology clinic to go through all these things. But if you're having trouble figuring it out on your own, that's where we come in. Phone and computer use. Many times folks with multiple sclerosis will have difficulty using their phone or computer. Sometimes it's because they just did have trouble using it before, even irrelevant to multiple sclerosis, just because technology can be hard. But sometimes it's because of a new problem like weakness or tremors or vision, for example. So there's all sorts of ways to modify the devices within them for free using built-in features, using Siri or Google Assistant, changing the type of mouse that's used for a person that doesn't have good hand function, setting up different applications. Like there's this one on here called Remote Mouse that I love, that if I can't use my mouse very well, or if I can't type very well, you can talk into your phone using the remote mouse and it'll pop up on your computer screen. And so that just makes it so much easier to type. Remote mouse is a great one. There's also this thing called an accessibility button that's built into most iPhones, and I think it's also on Android phones, where if you have trouble with screenshotting or zooming or getting to your home screen or any other utilities, you just pop it on that button, and it's just like a little shortcut. All these things are built into the phones and the computers for free, which is great. A lot of folks with MS, as well as neuromyelitis optica and other conditions similar, are experiencing issues with vision and having splotches in their vision, and so assistive technology can also be really helpful for that. There are technologies out there that can help you to read signs and documents in your environment, such as Seeing AI and Be My Eyes. You can utilize things inside the phone, like the Siri or Google Assistant, to help you to see things and understand your environment. There's also ways to modify contrast, magnification, and then for people who really have low vision, even if it's irrelevant to the fact that they have MS, some people as we age, we just have, our vision gets worse. I just got glasses this year, so I understand. Select to Speak can read the screen for you, which is really great. So just understand that some people need to use this technology that don't have MS, just because we got failing eyes. One important tool that I've used with a lot of patients with multiple sclerosis is the use of cognitive aids. Sometimes when we're experiencing that fog or fatigue or memory issues, it can be hard to remember to do certain tasks in your day, or to remember how to go about a task that you previously were able to do. So we talk about the use of a virtual assistant, like I mentioned earlier, for reminders of medications and routine, as well as family drop-ins. We talked about that kind of intercom system earlier. But there are ways for your family, if I have a family member with MS, for example, that I can say, Alexa, drop into this person and we can talk to each other in a walkie-talkie, especially if that person's not responding to me on the phone. I also can do things like an alert where I'll set on my text messages, Tell the Alexa that I'll be home in 15 minutes, and it'll announce it to your home. And so you can say, oh, they'll be here in 15 minutes. So that's really great if you have multiple caregivers that are coming in to assist. You also can do alerts to them to remind you of something every single day. So a VA, just so you know, is a virtual assistant. Alexa, remind me at 8 a.m. every day to take my medications. Every day at 8 a.m. you'll get an alert that'll help you to remind you to take your medications. And that can be for anything. Remind you to do your exercises, your stretches, take your meds, or remind me in 10 minutes to take the laundry out of the washer if that's something that becomes an issue. This new technology is really cool. It's called an NFC card. If you have a credit card, you have an NFC card in there because it's called a near-field communication device. It's built into your credit cards. It's what allows you to kind of tap it on your when you're paying. Once it's programmed, you can tap your phone to it, and it will bring up a specific website or a video or whatever is programmed to it to a reminder. So I have a patient right now who utilizes it to remember how to make her coffee. That was something that was really hard for her, is remembering all the steps to coffee. Or reminding her of all of her exercises, so she does an exercise video. So she'll tap it, and the exercise video will come up on her phone. It just makes it a lot easier, reduces some of these steps that's necessary, so that she can access that website after someone set it up for her. And some of my most fun things that I get to do are task-specific problem solving. I have patients that have been previously gamers. They've done fishing. They've done photography. They like their iPad. They play solitaire, all these things that they like to do, and they just can't anymore for some reason. And our job is to help fix those. I can't possibly go through every solution, but there is technology out there that it just can solve almost every problem, which is so cool. And if it's not or if it's not completely there yet, then it's in development. Like one I really like is the one on the bottom here. It's called a tremor dampening orthosis. There's a lot of research coming out about tremor dampening orthoses that basically help to take the tremor and make it less of a burden in the hand. It doesn't rid the person of the tremor, it just helps to manage it. And on that note too, a lot of assistive technology, but also a lot of occupational therapy for patients with MS is management. We have great providers that are helping out with the disease-modifying drugs and whatnot. That is their role. Our job is to help manage the symptoms, manage it, and also to help and promote independence and participation. So keep that lens in mind that you're like, I want to do it. I'm not sure if it's possible. Come ask. So some questions that I get all the time. How am I going to pay for all of this stuff? So a lot of times things are feasible out of pocket. I completely get that. That is not feasible for all of my patients. I work on the east side. I can tell you a lot of my patients don't have the resources for that. There are, though, some really wonderful grants and programs that are diagnosis specific. The MS Society has been awesome. If you're not a part of the MS Society, please sign up. They have fantastic resources available, and I've gotten some assistive technology covered as well as adaptive equipment like shower chairs and stuff covered through the MS Society. And sometimes insurance programs can cover these things, but not very commonly. But if you are in a workplace and you do require a modification on your behalf, BVR, am I correct? I almost said BWC, that's completely different. BVR, Bureau of Vocational Rehabilitation, can cover a purchase of equipment for a job. And I think that that is really helpful if someone does require a phone or computer modification that needs to be paid for. How expensive are these products? Really depends. I've had a patient that has purchased a reading pen with low vision that cost $2,000. That was her choice. I recommended something cheaper, but that was her choice. All the way down to free or cheap. Like, for example, an Alexa, very, very small Alexa and Echo Dot is somewhere between $15 and $25 right now, and for many people that will do the trick. So some are the many features that are built into the computer or phone are free. How many sessions do people see with AT? Oftentimes I'll see people once, but I have one patient right now, I've seen her 12 sessions for 90 minutes, and we're probably going to be seeing each other for another year. Just sort of depends on the goals. She has lots of goals. Some people, I just want to solve one problem, come in and see me for a couple, then you're done. What if I'm not tech savvy? I will meet you where you're at, I promise. My job is not to confuse. My job is to only give solutions that are meaningful and feasible. say that you want to come see assistive technology, say you're in occupational therapy even, or if you want to see occupational therapy even, talk to your physician about assistive technology or occupational therapy. All the clinicians that you guys are going to be seeing here are very familiar with us, so they're already going to know how to do it. But if you have a PCP or a neurologist outside of the system, then they will also, very regularly be giving referrals over to OT. And if you are already in occupational therapy, you do not need a new referral because technically I'm an occupational therapist. It's technically occupational therapy. And all sites, so we have sites, just so you know, in Upper Arlington near Doctors Hospital, in the east side of Columbus, in Westerville, and in Grady. And all of those are our sites, and they will treat all basic assistive technology needs, like phone, tablet, and computer access. But if you want things that are a little bit more complicated, like smart home technologies, that task-specific problem solving, any of that kind of stuff, you will have to come to East Side. My apologies. Come and see me and Christy. But we also can make things work. Go and visit other sites if need be. So I'm sure my references are very interesting to you, but there they are. I am here for any and all therapy questions, assistive technology questions as well. And I'm happy to give there's my email. If you need it, please email me. I love to respond to patients. And we will continue talking about that, talking about physical therapy later with Alyssa. Hopefully that'll round out some questions.